I have to go give plasma twice a week sometimes just to buy groceries at some points, also to pay a little bit of the bills.
That is a Newcastle teacher there at 923 here on this Thursday morning who says he sells his plasma for up to $60 a week just to try to make ends meet on his salary as a teacher. I'm joined once again by Governor Mary Fallin here as we're talking about the budget situation here, the difficulties now with just 11 days to go for the legislature to get their act together and get something on your desk, you're saying. I want to ask you about the teacher pay raises. It sounds right now, based on everything I'm hearing, that most likely teachers aren't getting a pay raise this session.
Well, not unless we do our job and put some revenue on the table. And that's why I've been telling everybody we got about 11 days to go. We got to act now if we want to fill these budget holes, much less put a teacher pay raise on the table. I called for a teacher pay raise back in my February speech and gave a plan forward to do that. But the legislature has yet to act on these things. And you have different groups that are locking up, blocking this, as I said earlier, saying I won't vote for this if you don't vote for that. And we need to come together as Republicans and Democrats, find a way forward for our state so we can pay our teachers, so we can have teachers in the classroom.
You keep saying, what kind of state do we want to be? You know, that's been your cry right now. And we hear about this issue more than any others from viewers. Teachers haven't got a pay raise in a decade.
Right.
You know, at this point, they've been hearing a lot of words saying that we're going to get you something, still hasn't happened. The actions they have seen, though, if actions speak louder than the words, no raise, increased cuts at their schools at almost every level, increased class sizes, more kids they're having to deal with every day.
Our population's grown in the state of Oklahoma. We have 48,000 more kids in our classroom than we've had.
So how do we say that the teachers yet another year, sorry, can't do it?
Well, we shouldn't say that. That's why I've been given this call that it's an emergency, it's a crisis, we need to act now, we need to find a way forward, we need to put ideas on the table. I laid out a big plan of all kinds of ideas to give the legislature some cover. I'm not running again, you know, that they have ideas on the table. Bring your plans, put them up on the board, vote for them, send them to my desk. But I can't do anything about it until they send me a bill that hits my desk that I can sign. We have 11 days left. If we want to have 4-day school weeks, which I think are not acceptable, if we don't want to pay teachers a pay raise, you know, we've got to address the budget problem.
At this point,
and put revenue on the table.
Governor, you understand at this point why teachers are moving to Texas for $10,000 more?
Absolutely. And our state employees hadn't had a pay raise. There's a lot of Oklahomans that hadn't had a pay raise. You know, we got to get our economy back on track. We got to make sure we're still a business-friendly Oklahoma, because if we do things that causes businesses not to come here, then that's going to hurt us even more. So there's a lot of work to be done. We got 11 days to do it.
But at this point, teachers should not be expecting a pay raise with this budget.
Well, not unless the legislature gets busy and makes some tough decisions. You know, we can either be part of the problem or we can be part of the solution. Okay. I'm hoping they'll be part of the solution.
I want to get to some of these viewer questions here that we're getting in here. We'll go to the first one right now. Pamela King writes this: please ask the governor why she won't help with the budget by taking the Medicaid expansion money. It would fund the Health Care Authority and free up funds for other state agencies. So this, just to help with our viewers here, this would be the money that would come in from the federal government as part of the Affordable Care Act. We were one of 19 states that chose not to take the Medicaid expansion money. It would have covered 150,000 people, and the Levitt report said it would have saved the state hundreds of millions of dollars in savings. It would have covered about 1 in 5 people uninsured. So why not take the money?
That's what the Levitt report said years ago.
Sure.
And what's happened on the Medicaid expansion is you got a lot of governors that say, wait a minute, you know, I expanded all these Medicaid services, now I can't afford it. So a lot of states are in financial trouble. In fact, there are 32 states that have either budget shortfalls or will have budget shortfalls this year because Medicaid costs, healthcare costs, as we all know, is going up tremendously. So the problem with taking Medicaid expansion money is, first of all, our legislature passed a bill not to, so we can't unless the legislature sends a bill that says we'll consider doing that. But the other thing is you have to have a 10% match. If you have almost $1 billion shortfall, how do you come up with the money to put the 10% down?
Meaning for our viewers, the federal government was giving 90% of covering
match,
those. We would need to cover 10%.
We'd have to cover 10%. So the Trump administration and Congress right now, because I've been on these phone calls, are now saying for states that expanded Medicaid that they're going to cut that 90% match back down to 50%. So if we had expanded Medicaid and we added all these new people into our system and then our Medicaid costs went up by 40%, 50%, we'd be in a world of hurt right now financially. Okay. So there's a reason why that didn't work out. Of course, our healthcare costs are going up. One of our biggest costs in state government is the growth of medical costs, healthcare costs, Medicaid costs in our state.
I want to make sure we get to some of the other questions here. If we can go to the next question here. This will be coming in from Deb. She says, please ask the governor why it's raising the cigarette tax always. Why not put a tax on beer and alcohol? Why are you targeting cigarettes?
Well, actually, we did have a bill that went through on some alcohol measures with some fees, and I think all things are on the table, as I said, but the legislature has to send those bills to my desk
So
to
why
consider.
target cigarettes, though?
Well, because we lose billions of dollars. We spend billions of dollars to take care of people who have health care problems, because cardiac disease, smoking is our #1 preventable illness in the state of Oklahoma, in our nation.
So you're trying to tax people to stop them from smoking?
We're trying to improve the health of Oklahoma and to get people to quit smoking in our state. Plus, it would drive down our Medicaid costs that the lady was just asking about, drive down our payment costs. It'd reduce your health insurance premiums, because if people are healthier and they have less heart disease and cancer and other things that come from smoking, it would help us all be healthier.
Okay, so we would tax people higher to try to stop them from smoking.
To be healthier as a state.
Eventually,
Absolutely.
though,
And we're ranked 40.
Eventually it would lead to fewer revenue there on the cigarette tax, though.
Well,
which would be a good problem to have.
Well, now, not necessarily, because if you drop your Medicaid rates, if you drop your Medicaid costs, because people are healthier, that would help.
Okay, I want to get to the next question here. Nelda asked this: how about state politicians take a cut in their wages by about half, including the governor's wages, until we get an end to the shortfall? Should not take more than a century, I think she jokes here, if we watch our pennies. So what do you say here to Nelda?
Well, of course, I understand there are a lot of Oklahomans that are hurting right now, and my message has been, we hear you. We know that you want our problem solved at the Capitol. We know we have Oklahomans that are feeling pinched too, but the decision has to be made. Do you want teachers in the classroom? Do you want to have 4-day school weeks or 5-day school weeks? Do you want to have highway patrolmen on the highways? Do you want to have prison guards in our prisons? Do you want to take care of the poor and the elderly, the nursing homes? Do you want to take care of
Should there be more accountability like this, though? Some financial incentive for lawmakers to make this happen?
Well, I think they should do their job. Absolutely. And that's why I said I'm going to veto the budget if we don't do our job.
Yeah, and I want to ask you about that. What to you is a red line here? What would make you veto that budget?
Well, if we cut state services to the point that it devastates our services and that they're ineffective, that we can't protect people, we can't keep our roads and bridges safe, that we can't fund our schools, or we have to go to 3-day school weeks instead of 5-day school weeks. I mean, those are the type of things I'm looking for. If we play what I call a smoke and mirrors game, to where we take money and transfer it here, or I'll give you an example. Last year we funded Department of Human Services, which takes care of abused children and the poor and the elderly and the disabled. We only funded them for 10 months of the fiscal year. We can't play those types of games.
Right.
We need to fix the budget.
So if this budget only takes care of the budget problem for this year, that's not enough for you?
Well, the budget will have to take care of the budget for this year.
But I mean, if we don't fix those structural issues.
Exactly. If we don't fix the structural issues, the question is, do we want to have massive cuts on top of the cuts we've already had? And I think you have a graph of this, by the way, of the cuts that have already been taken of the different state agencies.
Here it is here. These are some of the cuts here that have been 30 to 39% for these agencies.
Yeah.
So you see some of the agencies listed right there.
But we've had some state agencies, because we had a $1.3 billion shortfall last year with the energy downturn, that have taken tremendous cuts. Commerce has taken a 30% plus cut. Tourism's taken a 30% cut. Bureau of Drugs and Narcotics took over a 40% cut. Those are the people who are on the roads and bridges that are busting the drug dealers that are trafficking drugs down the highways. Do we want to cut those type of services to where they're devastating, ineffective for our state, and might cause loss of life?
Are you bringing both sides together here? Are you saying to the Republicans and the Democrats, come to my office, let's meet and come up with a compromise?
Absolutely. I met with the Democrats last week. I had the freshman Democrats in my office. I went through all the charts, the numbers. Here's the reality of where we're at. Make a decision. What do you want to cut? Tell me what you want to cut. Here you go. You got close to $900 million. And or what do you want to help put more revenue on the table to fund these different services? You say you're for paying teachers more. You say you're for fixing corrections. You say you're for mental health, substance abuse services. Tell me where you want to find the revenue. But we all have to work together as Democrats and Republicans to solve this issue. We don't want to be like Washington, D.C., that we don't get anything done.
So nothing is off the table here when it comes to new revenue or potential cuts?
Well, I'd say we need to put everything on the table and look at it.
Okay. All right, Governor Mary Fallin, thank you so much for taking your time to be here with us today. Really appreciate it.
Yeah, it's my pleasure. Thank you.
We're going to be right back after this.